Hello everyone, my name is Sophie Campbell. Thank you for joining me today to discuss health law. The world is amidst an urgent and massively impactful global health crisis due to COVID-19. This virus has placed unprecedented strain on healthcare systems, damaged the livelihoods of many, and forced the Canadian economy into a recession. Ultimately, COVID-19 has elucidated the horrific flaws in current international, Canadian, and Ontario laws that govern emergency response preparedness against infectious diseases. The international health regulations are the only international rules governing global health security. They are legally binding to 196 state parties, including Canada, which means that domestic laws must reflect the ideals put forth by the IHR. After SARS, the IHR were updated to include an internationally coordinated detection, assessment, notification, and response system, called the National IHR Focal Points. The focal points must report significant health-related events to the WHO within 24 hours of their occurrence so that it can be determined whether the event may require a coordinated international response. Despite the global call to action represented by the IHR, acceptable compliance with it has not been attained. This is largely due to the WHO's weak institutional effects, the absence of effective enforcement mechanisms, and the ability for global politics to negatively influence health outcomes within states. The Public Health Agency of Canada is the national IHR focal point of Canada and has been responsible for the implementation of the IHR. Canada has received an almost perfect score in its implementation of the recommendations listed in the IHR. The Quarantine Act 2005 is the first line of defense against transnationally spread infectious diseases. It authorizes disease control measures concerning the international movement of people and goods, including quarantine and isolation. Any traveler who suspects that they have a communicable disease must disclose that at a point of entry. They can be asked to undergo a health assessment in order to comply with treatment and even be arrested if they don't comply. Thus, this defense relies heavily on voluntary reporting of symptoms. In Ontario, the Emergency Management and Civil Protection Act of 1990 enables the government to declare a provincial emergency, as was done in March 2020. This law has enabled the closures of public and private establishments and mandated the rules for regions in stages 1, 2, and 3. The Health Protection and Promotion Act of 1990 provides the legal basis for quarantine and isolation in Ontario. So what needs to change? COVID-19 has spurred many discussions about IHR revision. The IHR could enable the WHO to receive state unverified information from non-state actors. It could dispatch independent experts to evaluate potential outbreaks to further strengthen state accountability, and a stronger reporting mechanism could improve compliance with the IHR. In Canada, we must rethink the approach of using quarantine and isolation as primary measures of response to a transnationally spread communicable disease. Updated laws will likely have to integrate multiple overlapping lines of defense, like the use of technology to predict outbreaks. As well, both the provincial and federal laws must consider the impact of strict measures like quarantine, such as psychological stress and loss of income. That's all. Thank you for listening.